Hello, this is Dr. Bouvier with Dr. and You, and you came to this video to learn a little bit more about how to collect specimens and where to take them for the coronavirus. This is a sheet, most of you have this already. It's a sheet of all the Directory of Michigan Health Departments. Step one, talk to your local health department in your county, get to know the nurses and say, hey, we're preparing for the coronavirus and other steps. Don't have any right now, but I just wanted to let you know that we may be bringing this stuff to you. What are your requirements? The requirements are basically get a hold of the public health department in your area, and then have step two is going to be how to collect this specimen, right? This is called universal transport media. All the local labs have this. It's very common culture transport media. This happens to come from our local lab. It's UTMRT. That's just universal specimen collection. This is for viruses, chlamydia, mycoplasma, uroplasma. It's universal transport media. So basically, step two is how do you collect this? You actually collect three. If you're going to collect for the patient, you have to have a nasopharyngeal, oropharyngeal, and a sputum sample. The nasopharyngeal is you take that, gloved up, collected. You take this swab, put it back into the nose. Remember, it goes back like 4 inches, and you go horizontally, not up, not down, but straight back horizontally with somebody in the sitting position. If you go into the left nares and you can't get through, just with slight pressure, go to the other side. It may cause some discomfort, but not really excruciating pain. But you go all the way in the back. It feels really weird. It may cause a little gagging, but you just go in there, roll it, come right back out. Put it into the tube. That's the first one. The oropharyngeal, back of the throat, along the top of the throat, along the edge of the throat, and the pillars of the throat. Where it's like a regular transport. Second specimen, put it in the separate tube. Third specimen, cough into the cup. Take the swab, take the collection from the cup, put it in the tube. All three tubes. Specimens go to your local public health department with the correct documentation. Now, as soon as this hits their lab over at the state, then there's about a 4-hour turnaround, but it's getting it to the lab that takes time. So there'll be a little bit of issue with that. Anybody, just talk with your medical director. They'll get the cough. If I'm associated with you, then just use my name, and it'll be delivered to me with my fax number, my cell number, and my information, my demographic information, if you need a physician to work with it. So again, this is Dr. Robert Bouvier. This is how you do the specimen. Get to know, you all should have this pamphlet. This is the Michigan Directory of the Health Departments. You all should have that in your texting. And of course, you should all have this sheet, which is just the information that you need to for yourself, but also for patients about the coronavirus and the flu. So other questions will be coming down the pike. This was just primarily for how you collect the specimens and get them out to your local health department. This is Dr. Bouvier with Dr. and You, clarifying that issue. Thank you very much.